Hello, all. I welcome all of you in the second Healthcare Transformation Summit 2020, the first day. We had a wonderful discussion, followed by a very eminent panel of technology heads of various hospitals discussing on future of EHR in India, challenges and opportunity. And then after a small break, we are moving on with the next session, which is of the most important topic right now being discussed in the country, and it is about embracing National Digital Health Mission, the scope and the challenges. So before that, I would just like to introduce you the audience, which I can see a lot of people have started joining this session. I would like to introduce you with eHealth. From last 16 to 17 years, eHealth is writing about healthcare enterprise and healthcare innovations. And across Asia Pacific region, we are one of the most popular magazines and online portal to be read. And we have done more than hundreds or what I think more than 200, 300 events, conferences around various aspects of healthcare vertical in India and also in some different parts of the world. And in this pandemic time also we haven't stopped, and we are connecting the stakeholders to each other virtually, and Healthcare Transformation Summit is one of those platforms where we are doing the job of connecting people to each other for the betterment of the healthcare ecosystem of the country. And today we are moving on with this next session, and it is, as I said, about embracing NDHM, the scope and challenges. And I will introduce all the panelists once before we start the discussion. I'll start with Ma'am Padma Jaiswal. She is Secretary to Government for Economics and Statistics, Department of Economics and Statistics, Government of Puducherry. Madam, आपका स्वागत है. Welcome. And then I invite on stage Mr. K. Madan Gopal, Senior Consultant in Niti Aayog. Welcome, sir. And then I invite Dr. Atul Mohan Kochar, CEO NABH, with us. I welcome him. Welcome, sir. Dr. K. Hari Prasad, President of Hospitals Division in Apollo Hospitals Enterprises Limited. Welcome, sir. And Mr. Abhishek Kumar, who is Executive Director for IT in Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. I welcome all of you. And to start with, as you all can see, that topic is around the National Digital Health Mission. So, and you all have been experts in healthcare sector as well as digital health. Even Padma Jaiswal has been IT secretary for a long time. So she has a great experience, and all of you are dealing with digital health. So I will request for initial remarks from all of you, and then we will go on with the discussion. So Padma ji, I'll request you to please share your initial remarks. You're on mute, Padma ji. Can you please unmute yourself here?
Yeah. Yes, I'm not audible.
You're audible.
I'm not audible.
Audible.
I'm audible. Okay. Okay. Good afternoon to every one of you, and I thank organizers for inviting me into this panel discussion of this Health Transformation Summit. And I also congratulate them that they are, heading on with their own objective of holding the various kind of discussions and conferences, even at the hour when we are been hit by a pandemic, and which has affected so much of us entire the globe. At present, I am dealing with the Economics and Statistics Department. Now, this department is basically conducting the surveys and various kind of other data, collecting the data of various departments, and also is also analyzing the social and economic impact of various centrally sponsored schemes through randomized trial controls method. So we are collecting the data of the survey of the entire department, and also we are also implementing the World Bank sponsored program of statistical strengthening scheme, under which we are digitizing all the departments and integrating their data. At the same time, this department is also responsible for implementation of artificial intelligence and machine learning in the UT of Puducherry. So out of this kind of surveys, various kind of surveys, and the collection of data that we have done, I would just like to offer my comments on this topic of National Digital Health Mission, which pertains to Department of Health. Now, this is about digital. This is one of the offshoots of the Ayushman Jan Arogya scheme, which was mainly for digitization and delivery of the services of the health to the common citizen through the IT platform. So now, with the Puducherry has been one of the UTs wherein the Ayushman Bharat implementation of Ayushman Bharat was very successful, and it has really reached the nook and corner of the people in rural places also, and in the remote areas of Puducherry also. So this because here the private sector, there is a lot of competition among the private sector, and the impaneled hospitals which were on our list, they were vying and they were competing with each other to give proper delivery of the services, of the health services to the citizen. Therefore, they were reaping the benefits of of the centrally sponsored schemes of Ayushman Bharat. So Ayushman Bharat was very successful, and in the process, since this scheme was digitally implemented, so in the process we have also built on so much of data on this particular scheme. So now that also now the Niti Aayog has also made an announcement on a recent announcement about now implementation of this National Digital Health Mission, under which the data will be stored of all the patients and doctors and practitioners, hospitals, all the stakeholders of the health department in the digitized form, in the form of a code. So this is an initiative, and moreover, 6 union territories have been selected for implementation of this project, of the National Digital Health Mission project. So out of that, Puducherry is also one of the places where this implementation will be undertaken on the pilot basis. So therefore, my department, Economic and Statistic Department, is a key stakeholder in Puducherry in implementation of this National Digital Health Mission. And while we are collecting the data regarding the patients and about the medical practitioners, various laboratories, diagnostic centers, and also hospitals. So in the process, we are also building up on the data that we have earlier collected while we were implementing the Ayushman Bharat. So already Ayushman Bharat was very much successful. Now what we have seen in the entire country, that and also entire around the globe, that the health infrastructure has come under a lot of stress. Even those countries which had a very strongest of health infrastructure, it was not able to cope up with the demand of this pandemic. And moreover, India, we cannot say that in India we have a weak health infrastructure. It depends. It is quite diverse. Now, in southern India, we have got a very robust health infrastructure, and the population per doctor ratio and the patient per doctor ratio was quite good and healthy. But still, we were facing a lot of stress and strain on our infrastructure in the previous days when Puducherry was experiencing the peak, and so much so that government department of health has to take over various private hospitals also, and has to offer the health services free of cost. So in various places in Puducherry, the private hospitals were taken over by the government. Like in Puducherry, almost we were never having the shortage of beds, but now because of this pandemic, the huge strain on the health infrastructure, the government has to take over the various private hospitals also. And also we had seen the where the fragility of our health infrastructure lies. We had experienced that the fragility of the health and weakness of the health infrastructure exists in delivery of the services to the rural and the remotest part of the area. Now, how do we continue delivering the services, and because it requires not only the hospital care but out of hospital care and nutrition also of the patient. So therefore, what we have seen is that how do we deliver the outpatient care to the remotest part, and to those patients who have been discharged by the hospital. So all these
Right.
challenges were posed to us, and the Puducherry government, what they have done is, already we have already collected the data, and we were already in talks with various private firms to into like build up some diagnostics. so that we can,
Right.
this is very much high on the specificity and also high on the very sensitivity, so that we can, maybe diagnose the outcomes of the COVID patients. So the Jipmer Institute, which is in Puducherry, which is a Jawaharlal Nehru Research Institute, they have also, engaged and roped up some startups for identifying, the COVID positivity out of radiology, out of CT scan, and out of various kind of other innovations. So, and we are also in talks with various private sectors so that we can give the data to them, and they can come out with various diagnostic kits, so that the one diagnostic kit can be more mobile, and we can go door to door, and we can identify the various patients or various infections which are underway. And now, before I just want to make a last comment here. Now, with this, because of this pandemic, one more thing has been triggered, is that research. Now, Puducherry is very quite rich in various kind of research institute. The Vector Airborne Research Institute is also placed in Puducherry. So now this pandemic, which has posed a risk to the livelihood and lives of people, not just only the health, and which has ultimately affected our economic development GDP growth rate. So therefore, we have to be really now increase the efforts on the front of research and development regarding the various epidemiological aspects. Now we have to see the exchange, the human interface with the animals, that what kind of viruses we are getting exposed to while we are interfacing, and while we are exposing ourselves to various animal kingdom and the species kingdom also. So we have to revisit our policy regarding forest deforestation, urbanization, and also the this livestock farming, what we were doing, and also the agriculture farming also. Because when we take up various kind of objectives like this urbanization, like this deforestation and livestock farming, en masse livestock farming, we are exposing ourselves to the various kind of viruses, and which viruses are there in the environment, which are very quick to express itself in the form of epidemic. So this particular research has been going on, and now various research institutes are testing various hypotheses regarding this, exposure to the human being with the animal habitat, and also in the process, various kind of data is getting exchanged. Now, one point which I want to highlight here is that data. Whether you want your artificial intelligence to be guided by the data which is available in social media, or whether you want your artificial intelligence to be guided by the data which is totally rigorous, which is tested, which is well proofed, and which is confirmed, and which can be comparable internationally. So these two things are very different. And if your data has to be comparable, if you want your data to be rigorous, to stand the test of times, and if you want your hypothesis and conclusions to be well versed, then your data has to be robust. It is just, input is equal to output. What kind of input are you putting so that you can have a good output? If you put trash, you will get trash. So artificial intelligence has to be dictated by a data which is very rigorous and robust. And so
Right.
therefore, the Economics and Statistics Department in Puducherry is playing a very key role in providing the data to all these kind of, private sector, also to the university research institutes which are undertaking the research at this point in time. Now, I will again, answer the further questions raised to me by the moderator. But for now, I think I have put forth my inputs.
Thank you, Padmaji, and thank you for putting up the stage perspective and also mentioning very important issues. And one of them is data, and which you are working on also, and it is the key. Whatever is whatever thing you come up with, data is the key behind that. So I will now come to Mr. Abhishek Kumar, who is Executive Director for IT in Ayushman Bharat, which is also about a huge data. So Abhishek ji, I will request you to kindly share your thoughts, initial remarks on this topic, and please throw some light on how IT is going on in Ayushman Bharat.
Hello everyone. Let me talk about NDHM, National Digital Health Mission. So as on date, NHA is implementing NDHM, and Ayushman Bharat PMJ, it is also being implemented by NHA. So both the schemes, NDHM and Ayushman Bharat PMJ, are being implemented by NHA. So naturally, people get little bit confused between these two schemes. So let me put things into perspective. When we talk about NDHM, what is the meaning of NDHM and why this scheme has been launched? So, in one sentence, NDHM has been launched to establish national digital health ecosystem. So, why do we need a national digital health ecosystem? As on date, entire health ecosystem in our country, it is in fragmented state. So that way, NDHM is a very ambitious scheme. Ambitious not in terms of budget, not in terms of any particular disease, not in terms of any particular health scheme per se, but in the sense that it intends to change entire health landscape of the country. So that is why objective of NDHM is stated as creation of national digital health ecosystem. As on date, various hospitals, various health scheme, various states, various labs, all of them are working in silos. So how do we create fully interoperable national digital health ecosystem? In simple terms, that is the objective of NDHM. Now, how does NDHM seeks to achieve it? There are some key steps to establish a national digital health ecosystem. What is the first step? First step is we should be able to identify all the stakeholders, all the players in the health ecosystem. For that purpose, in NDHM, we are creating two things. First is health ID for every willing individual. Second, registry of all the entities operating in health ecosystems like doctors, hospitals, labs, various kind of healthcare workforce. So those registries are being prepared because in any digital system, unless we are able to uniquely identify an entity, we can't establish an interoperable system. So that is the first important component for establishing an interoperable national digital health ecosystem. What is the next aspect? For interoperability, it is essential that various systems, various software, various health information management system being used in the ecosystem, they must comply to certain standards. So there are two types of standards: technology standards and data standards. So NDHM seeks to promote those technology and data standards across ecosystem so that various systems, various software, various data operating in the health ecosystem is interoperable and different systems can talk to each other. Now, once we have completed these two steps, what are the immediate benefits from the end user perspective? From individual perspective, the most immediate benefit is that the individual will have complete view of his or her health records. So the person will get longitudinal view of health record because based upon health ID and based upon ID of various hospital labs, all the records can be integrated. And let me clarify one more aspect. Whenever we say that records are to be interlinked or a person will get integrated view of data, it sometimes create confusion that a central repository of health records is being created, and it leads to so much anxiety and uproar at many levels. So let me clarify that in NDHM there is no intent to create any centralized repository of health records. Rather, intent is to create interoperable system through unique IDs and open APIs and standards so that health data spread across the ecosystem can be linked and it can be viewed by the data principal. That means the owner to which the data belongs. Now, once the data gets consolidated and the owner is able to see data at consolidated level, data can be shared across the ecosystem based on consent. So that way, from healthcare perspective, it is going to be a revolutionary change. We are carrying a heavy health record, and traceability of health record in itself is a mega issue. So these are the basic features. On the top of it, many features can be built like telemedicine, e-pharmacy, and many value-added services can be built on the top of these basic building blocks. Like once we have ensured complete interoperability, any person moving from X hospital or lab to Y hospital or lab, there is no need for any physical movement of any record. Every record can move electronically. Any prescription for diagnostic test can automatically move from a hospital to lab and lab to a hospital based upon the choice exercised by individuals. Further, going ahead, once we have created such a system, there will be an option to anonymize data and use anonymized data for analytics and research. It will support our clinical decision support system, and it will give a very big boost to analytics and research. Research can happen at two levels. Policy level, what kind of intervention on the part of government are more effective, and medical research, what kind of diagnostic techniques and drugs are more effective in dealing with the various kinds of diseases. So I think roughly I have covered the broad spectrum of opportunities being created by NDHM. So let me briefly talk about challenges as well. What are the challenges we are foreseeing in implementation of NDHM? The first biggest challenge is establishment of trust. When we establish any such digital system, there is natural apprehension that what will happen to data privacy and security, whether my data will be misused. So obviously, handling this insecurity of people is very key to success of project of this mega scale. So naturally, we are working upon various policies to take care of data security and privacy. And basic principle is that data principle should be in command of data. And any such data cannot be accessed by anybody unless the person gives consent that my data can be accessed. Now, second big challenge, adoption of NDHM. As NDHM is not about any typical particular scheme. NDHM is very ambitious in the sense that it intends to change entire health ecosystem. So such a scheme cannot succeed unless the stakeholders are willing to cooperate and they see a value proposition in adoption of NDHM. So that way, adoption by various stakeholders, hospitals, labs, including government, private, individuals, doctors, everybody, their participation is very key to success of NDHM. This is at principal level. Now, coming to implementation level, as we discussed, adoption of standards is key to success of NDHM. So this adoption of standards is not so simple. There are various standards like FHIR, Estimate CT, LOANC. So as on date, this adoption of standards in healthcare ecosystem in India is first of all minimal. Secondly, it is not uniform. So we intend to go progressively so that these standards are adopted across the ecosystem in steps, and we are able to bring uniformity in the ecosystem. Now, next point, when we talk about applying standards, it becomes essential that data is largely structured in the system. That means the handwritten prescriptions, handwritten note, they will slowly go out of picture. But it is easier said than done because mostly doctors, professionals, they are not used to working in this manner. So we are thinking about this aspect as well. There are various technological aspects which can help us in this regard, like using NLP, natural language processing tools, which can enable a doctor to use adopt these standards without putting too much burden on them. Next big challenge, bringing state governments on board, because as we know, health is a state subject. Secondly, this health digital health system across various states of India is at different levels of maturity. So we need to take that into account, and all the state governments need to be onboarded. Only then such a scheme can achieve maximum level. And digital and internet penetration level across India, that is also a big challenge, because when we talk about such ambitious scheme, naturally the people who are out of digital and internet penetration system, there is a fear of they being left out. So naturally such people also need to be adopted in such a system. And to conclude, one last point, coming to value added services like telemedicine and e-pharmacy, one major challenge is about regulatory and policy framework, because existing regulatory and policy framework may not be sufficient and clear enough to support a digital revolution of this scale. So that requires a major effort before value added services of NDHM can be fully leveraged. Thank you.
Thank you, Mr. Vijay Kumar. You point to point, you explained the whole topic about the NDHM, its scope and its challenges, and it has set a really fantastic tone for the discussion to take further, that on embracing the NDHM, the scope and challenges. I will move on to another policymaker side in Niti Aayog. Mr. K. Madan Gopal is there, senior consultant. He is also pretty much involved in uh, policy framing of healthcare in India. So, your initial remarks in 5 to 6 minutes, Mr. Madan Gopal, please.
First is I'm a medical doctor, so that's a correction from your side. I'm not Mr. I have a postgraduate in public health, so that's my expertise. First, I will take you that how this NDHM thing has evolved. If you look at the things as a question posed by some of the uh, participants, that whether the NDHM will accelerate the country progress towards universal healthcare or not. That's a very interesting and pertinent question. And we, as everybody is as a hype is being created that if a digital thing will come, it will have solution to all the healthcare problems which we are having, which is a very distant reality. If you look at the ongoing COVID response and look at the technology and how the technology has aided, but technology is the tool to aid the implementation. It's the back end and the people who have to work in the medical field. We have to have a think that if you look at the example of digitalization of the OPD services in All India Institute, how it how the uptake of that has happened. If we are talking about technology, we have to see that how the practice is built into the technology, not the technology resulting in practice of the medical practices. That's the bottom line. If we are building practice into technology, then there would be a marriage between the doctor, utilization of the service, everything will happen. But if you say that the technology is the solution, I give you the solution, you adopt it, you practice it, that would be a very, very distant reality. And that's a challenge which the technologists and others has to grapple and find an answer to this. Unless you find an answer, you'll be always struggling that the doctors are not using. First, you see how the practices are, how you can improve that practices by use of technology, and how the technology can help in the practices. Just take an example of COVID response. We have everybody has used the technology, but few only one or two countries they have used it to the maximum. Technology, they will say that the contact is there for 14 days, but what to do with the contacts? It will throw, but there is no support system to handle that thing. And you have just find a problem, but there is a solution. The solution has to come from the practitioners, and you have to see that how the practice is built in the technology and how the technology can aid into a practice. That kind of synchronization and coordination has to happen. That's one thing. I will just take you to the back. You have given me very less time, but I will try to see that how I can justify that thing. One
No, so
is
you can
when uh,
add five
we
more
have been
minutes.
talking about we have been talking about. Okay, no problem. Yeah, that's your discretion. No issues. One is that if you look at the evolution of the digital things in the country, you will appreciate that we are moving towards universal healthcare, but slowly and slowly, gradually, and technology is an aid for accelerating that pace. That's one thing. If you look at the history, way back in the early 2000s, there is a University of Medicine in US. They told that the technology has to be adopted for accelerating pace in the medical field. It's almost 2 3 decades back. If you look at the evolution of the digital healthcare, we started with the Sustainable Development Goals, where we have envisaged the universal healthcare. That's one thing. In the universal healthcare, also affordable technologies, how the affordable technologies are there, which can at least address the financial risk and other things. Then after that, into around the start of this 2011, 2012, we had the Clinical Establishment Act, and there have been very late adoption of the Clinical Establishment Act by different states. In that Clinical Establishment Act, the electronic health records have been there and mandated. And very few people know that for assisting the hospital, that for assisting the hospital for codification of the symptoms and this, and to create electronic records and to have ICD-10 classification, the country has taken a license for the country. Even if you are a private institution, a government institution, you could have used that NOMAD CD license for coding your electronic records as per the ICD classification. That was there. And for assisting the hospitals, there was CDEC was there. He was made the repository for helping the hospital in making softwares and for digitalization of the record. That was the effort which was started there. And apart from that, in national health policy, we have envisaged that we will digitalize all the entire health ecosystem. That digitalization in the National Health Policy 2007, that digitalization was there. And when the Ayushman Bharat, apart from that, there were efforts going on at the primary health center, because if you look at the program per se, why I'm giving background, otherwise you will never appreciate what we are envisaging from the National Health Digital Health Mission. If you look at the health system which has progressed in the country over the last 60, 70 years, it has evolved from the Boer Committee to Almata Declaration until now, it has evolved and a system has been built. And the system is quite resilient, as we have witnessed during the COVID time. It is a resilient system. But we have to see that how we build on this system rather than creating a parallel system. For if you look at the health department, what websites, you are having a lot of websites, a lot of web portals are there. For a single beneficiary, he is subscribed to malaria, he is having immunization, he is having the ANC services, he is having everything. The single information is collected by different program. That was there. So to have a single platform so that all the programs they talk to each other, there was the need for having a single ID for all these people. It started from there. Then international organization, integrated health information platform was made, in which all the programs were supposed to migrate into that, but because of COVID, that has been delayed. Subsequently, in 2018, the Ayushman Bharat was launched. Ayushman Bharat is having two components. One is the health and wellness component, which essentially talks about the preventive, promotive, and the extension services. And the second is the PMJ, which is the Pradhan Mantri Jan Arogya Yojana. When we were rolling out this program, there was we were grappling because it was built on to the RSBY to say. Then we felt that there is a need for having a software. So we tried to talk it as track one and track two. The track one was quickly roll out the PMJ program, have a software so that the rollout of the scheme can happen. So we have zeroed down and we have adopted the Telangana state software for PMJ1, which they call PMJ1 software, which was adopted and customized to be used for the requirements of the PMJ program. Subsequently, there was a need felt that which integrated health information platform, which was evolving also. We felt the need that we should have a stack in which all the programs can ride and we can have a common identifier in which the information one program can talk to each other. So we brought out a stack document. That stock document was in the public domain and a lot of consultations happened. After this document has been adopted by the ministry, then there was a committee formed, and the committee has recommended, it has come up with a blueprint for the digitalization of the health ecosystem. To roll out this thing, the Digital Health Mission came. Now we are having two systems. One is the Digital Health Mission, which is trying to digitalize the records of the system which is available in PMJ, that is the private hospitals, and this that system will come. Ultimately, we are aiming at a continuum of care. That means the primary health care which is coming, the people who are there, the health and wellness centers, which was envisaged. Because if you look at PMJ uptake, best of the insurance and assurance scheme, if 3% of the population comes to the hospital and avails treatment, do we have that amount of beds which are available which can cater to if 100% utilization happens? No, we don't have. So this health and wellness center, they act as gatekeepers. They will screen the population. They will. That's why the wellness component was built into that, so that there is a continuum of care from the health and wellness center to the PMJ. So first round, they are working on the sixth component, which Abhishek has already mentioned that, and based on that, group is also working how to see the continuum of care from the health and wellness center to the which can both the systems can talk to each other. Apart from that, one of the challenges which have been highlighted is how the practice can be put into this, because we have been coming across many private players also. They are coming with about the platform. They are saying that they are having an electronic digital platform which can aid in this, but more or less, unless the practitioners they are convinced that it is would be useful. I'm just citing because based on my other examples, uh, in one program they have created a system of tracking the migrants from one source to the destination. But once the question was posed, they have created a very beautiful system spending around 20-30 lakh rupees. And but the problem was that the destination data and the source data, both the same persons, they were not talking to each other. As a result, the system was to be self. It is one of the major programs. But apart from that, what we have envisioned in the digital mission is a federated architecture. That means there has to be some responsibility at the central level, state level, and the health institution level. All the three levels, the structure is there. The data security, interoperability has been talked by Abhishek. So this architecture is there, but the guiding principles remains the same. That uh, for the NDHM pilot is going on. The he has already mentioned the volunteerism, then the privacy, and this inclusivity, then the seamless portability, and how we can educate the people. That kind of guiding principles are there. But presently, it has been in the union territories only. But we see that how we expanded based on the uptake of this. The electronic health record, the electronic health card, and the personal health record, we have been grappling it for many years. Even in the best of the European countries, which are having a long-standing social insurance scheme and the social protection for almost more than 100 years, they're also grappling with the issue of health card. So these are all the challenges, and we will have to find solutions to that. But to address the data privacy and other concerns, the National Health Authority, which is the agency under Ministry of Health, to implement the PMJ, and since they are having an architecture, that is, they have evolved a PMJ 2.2 architecture, which the private can also use that. So they are leading this NDHM program. They would be subsequently having a wider, more role in this. That's one thing. Apart from that, the document which they have released is compliant to all the IT Act, the Aadhaar Act, the PDP bill, as well as the Supreme Court judgment. Based on that, the data privacy and other things have been tried to be addressed by NHA, and they have brought out a policy document on that. And I think right now it's uh, uh, initial inputs are this much only. Let's see that how the questions comes, and we can take questions after that. Thank you very much.
Right, sir. But before I move on to another speaker, meanwhile you were addressing, there were three questions on similar line, and that line was how government is getting people to participate, adapt, and accept this digitized environment. So, is there any specific strategy with government, Dr.
So
Madan
right
Gopal?
now it's all voluntary basis. Yes, yes. Uh, right now it is on a voluntary basis, and as Abhishek has mentioned, it is voluntary right now. And there have been a lot of questions about privacy and other things. The document is there
Yes.
in the public domain, so they have tried to address that thing. Then the bill for privacy is also now would be seeing the light of the day, provided it is passed. That thing is there, but it's entirely voluntary driven right now. And if it is successful in the union territory, then we can upscale it and cover to other states and see that how how much it can be made mandatory. Right now, it is voluntary only, and if people see value in this, it will take off. If they don't see value, that's the only uh, uh, assumption which we are having. They will see value in this. They will see, because if you look at the consultation with the which some agencies are doing, they're digitalizing the record and having consultation with the external hospitals in the US and other places. They are having. If you look at some of the places in Delhi, you'll find that people are doing the digitalization thing, and people are seeing value, and they are subscribing to the services of that. Now these services are being provided free of cost to them, and they would be having their digitized record. They can have access to this, and they can consult any of the doctors of the choice. That kind of awareness will come slowly and slowly. It's not that it would be in one day or so, but this will come, because if you look at the uh, people who are accessing services in Singapore and others, they are having digital records, and they are having people who are making
Yes.
digital records for them. That is all scanned copies, and they are sending that records for consultation. Others, that kind of movement will come, but it will take time.
Right. Dr. K. Madan Gopal, thank you very much for explaining us about these issues and challenges and scope, the aspects of NDHM. CEO NAPH, Dr. Kocher, I would like to ask you your perspective on NDHM, please.
Thank you, Mr. Karthik. Thank you for this opportunity. I think this has been a wonderful learning for me also, and for all of us. There's some very good things being said about the entire process of NDHM. Padmavan talked about the importance of right collation of data, the validation and everything. Then Abhishek ji explained us about the integration of the fragmented healthcare structure which is currently existing in the country. Then Dr. Madan Gopal, he took us through the entire strategy and the wonderful since the Bose committee and Almata. So I'll only slightly build upon that National Digital Health Mission is a wonderful revolutionary concept. It has truly been said the digital backbone of the healthcare infra in the country. It's a very ambitious step, and it's likely to change, and it's a sure step towards the digital India concept, the self-reliant Atmanirbhar Bharat, which for which the clarion call has already been given, and so it'll go a long way. Keeping in perspective the NABH angle, I mean NABH, we are as you are already aware, we are into accreditation standards for the past 15 years. Uh, so now time has come, because with every new challenge comes a lot of responsibility also. I mean, so it's been said earlier that we need to integrate the healthcare in a very structured manner, and the issues of interoperability, the issues of consent, information gathering, the privacy, security, all those need to be standardized. So while government has already outlined that, and Abhishek ji mentioned that FHIR, the free open source standards, have to be deployed, and there are already tech standards in the country, in the world, which are already there in different domains. But in case we have to take steps forward, and reach out to the people, because National Digital Health Mission is one step, sure step, which like a backbone will help in taking the provider. It'll help us in overtaking the restrictions which are there of the country, like the unfavorable provider versus patient ratio, which is currently there, because we are a developing country. So to reach out to the masses, to reach out to not only tier 2, tier 3, but tier 5, 6 corners of the country also, this will help go a long way. But with that comes the responsibility of ensuring privacy, security, the data protection, and a proper structure to it. I mean, we'll be gathering, no doubt, the health registry which is there. Then there are so many sub-components of National Digital Health Mission, which as a clinician I can say, which are very, very favorable and very, very promising. Uh, so keeping all those in mind, then there's the issue of integrating the pharmaceutical services also. I mean, health being a state subject, I mean, each state is free, and each state is free to opt out and opt in of various services, various methodologies. But this will give the common structure to the entire healthcare delivery platform. The Ayush segment also needs to be integrated very well. So all our standards, all NABH standards for the past 15 years, and we are currently running about 21 programs under the three broad headings of accreditation, certification, and empanelment. So we try to cater to the level of PHC, like some states like Gujarat have done very well. Puducherry has done exceptionally well. I mean, so all those smaller to bigger states, we cater to various programs, hospitals, small healthcare, blood bank, medical imaging services. So all these various programs we try to integrate on a digital platform also, by initiating national digital NABH digital health standards. So we are currently working on those draft lines. Our only challenge is that we have to stay within the lines while coloring. I mean, not get too ambitious, and try to remain true to the spirit of Atmanirbharta. I mean, it's very easy for us to, take out the best of ISO, best of HL7, best of the industry standards worldwide. But then we do not want our hospitals or healthcare providers to be too dependent on these. What can I say? They are industry standards, but we need our own standards of the country, built with the best of the lot, just like NABH. So NABH standards are comparable to the best in the world. I mean, we are benchmarked by ISQA, and yet we are totally homegrown. So similarly, when we talk about the information privacy, security, interoperability for digital health, we need standards which can be understood by our healthcare providers to the last line. I mean, to the implementers, who are the implementers, who are the custodian. We do not want them to be geek standards, which are very, very, which will have a long learning curve, so that people may have to spend a lot again on buying these certification or having those special implementers. So fortunately, the National Digital Health Blueprint is already in been notified, and that digital blueprint, based on the National Digital Health Mission, is a very, very promising document, and NABH is drafting those standards. and I hope it will bring in clarity on all the domains of digital health, which is beyond telehealth, beyond mobile health, beyond wearable devices, or there are so many sub components. So that is my brief take on that. But it's a very promising thing. It's a revolutionary thing, and over the years, we are likely to say, because it is still voluntary, it's likely to remain voluntary. But over the years, this is a major step to happen to Indian healthcare. It's a very promising domain which is there, and I'm sure as we progress over the years, we'll have lots of clarity. I mean, and along with Ayushman Bharat PMJ, National Digital Health Mission is going to take quality healthcare to the last man in the line, which has been a dream.
Thank you.
Thank you so much.
Thank you, Dr. Atul, for sharing your optimistic approach towards NDHM. And lastly, but not the least, we must have an industry perspective also. And we are happy here that Dr. K. Hari Prasad, who is president of the entire hospital division of Apollo Hospitals, is with us. And Dr. K. Hari Prasad, I would also like to ask you that how the companies, the private hospitals, how the industry is looking at it in NDHM, and what is the perspective in terms of industries towards NDHM. And would like request you to share your views, please, Dr. K. Hari Prasad.
Good afternoon and thank you. And being the last speaker, everybody, all the experts have said everything. So what I would be saying will be a lot of repetition, but it will be a summary from a provider's perspective. So I'd like to start with a quote from Dr. V.K. Paul, who is a member of the Niti Aayog and who heads the health and nutrition vertical. I quote, "There is a scope to align all stakeholders for the larger benefit of the society. As a think tank, we are looking at many reforms in health sector, aligning traditional and modern approaches for a larger good," unquote. This quote summarizes the mission of NDHM, and it's a very exciting journey that the country has embarked upon with the ultimate goal of bringing equality healthcare for all. I believe that every challenge is an opportunity. I would therefore like to focus on the challenges and the solutions of NDHM and what NDHM is trying to bring about in its journey. Healthcare is very fragmented in the country. Over 95% of healthcare is provided by the unorganized sector. This includes allopathic practitioners, qualified healthcare providers of the traditional medicine like homeopathy and Ayurveda, and even quacks. A study actually suggested that as much as 75% of healthcare in rural India is actually provided by quacks. It is sad, but it is a reality. DigiDoctor and Health Facility Registry, which are part of the NDHM, is the solution for this. It aims at consolidating the entire medical fraternity and create an online platform which will help the common man in choosing the right doctor and the right institution based on credible information. Whether we like it or not, there's a huge trust deficit between the health providers and the community. This is a huge issue, not just for the providers, but for the community also. Lack of transparency, wide variation in costs, different standards of care, episodic nature of care, variable outcomes, and a communication gap between the patient and provider are some of the issues leading to this trust deficit. I strongly believe that NDHM, when fully operational, it's got a 5-year roadmap, but when it is fully operational, will bridge this trust gap. NDHM is striving to provide efficient, accessible, inclusive, affordable, and timely care in a safe manner with the support of a seamless online platform. These words I've just picked up from the NDHM document. Standards of care vary widely depending on the provider and the institution. Different care pathways are adopted by different providers for the same ailment. On many occasions, the pathway chosen may be outdated or may not be evidence-based. There is no reason why every individual in the country does not have access to uniform standards of care. The clinical decision support system, along with the other measures being taken up by NDHM, will help in standardizing care, and every individual can be actually assured of the same level of care irrespective of the provider and the institution. Healthcare in India is episodic in nature. Continuum of care is an important ingredient of good healthcare system. Today, we have no means of offering continuum of care across the country. It could be happening in few large institutions which have embarked on the digital journey, like our group of hospitals, but it is an exception rather than a rule. Health ID, personal health record, and electronic medical records will help in continuum of care, and the common man will benefit immensely. Nomenclature of diagnostic tests, procedures done, and treatment given vary widely, and even if there is a methodology to procure data, it will be useless as the nomenclature is different. For example, a simple thing like a blood sugar test is reported in different names. Some call it post-lunch blood sugar, some others call it postprandial blood sugar, and some lazy ones call it PLBS or PPBS. With a plethora of names for the same test or procedure, an IT system cannot make sense of the data that is getting into it. NDHM is introducing the globally accepted norms like ICD 10 and 11 coding, SNOMED, and law coding, and many other things. And this will make the data a gold mine for multiple epidemiological, research, analytical studies, and will ultimately contribute to artificial intelligence in healthcare of our own. This will actually lead to the 4 P's of medicine: prevention, prediction, precision, and personalization. This will be a huge leap in the level of care we provide to the people of our country. The success of any system depends on the outcomes. Credible data, appropriate data mining, and appropriate analytics are essential prerequisites for understanding outcomes. Today, we have none of this. I claim I have the best success rate in heart surgery at 99.2%, and another hospital claims a success rate of 99.7%, and the third one will claim a success rate of 100%. This is happening, and people are basing their decisions on these unverified claims which are devoid of any credibility. Once the healthcare system gets onto the digital platform, outcomes will be clearly shown, and the community has an opportunity to make decisions based on credible and verifiable information. I can go on about the current challenges and opportunities NDHM brings as a provider. However, there are complex technological challenges, and I genuinely believe that we have the best brain power in the world to find solutions to these complex challenges. Privacy, data security, interoperability, and portability are some of the issues NDHM is already talking about and working on them. Having been on the digital journey for many years, there's one challenge which I believe is the most difficult one to get over. It is the human challenge. NDHM may create the best digital platform, but it will be only as good as its users. The biggest beasts in the room are the providers. Being a doctor, I can take the liberty of saying this. Doctors will be the biggest roadblock for NDHM. Unless they see value in the system, they are not going to adopt it, and they will find a zillion reasons for not using it. NDHM has to adopt a carrot and stick approach to get the providers on board. While getting an efficient platform is critical, success really depends on how well the platform is used. NDHM is striving to be a wellness-centric, inclusive platform that empowers the citizens of this country and brings in accountability into the healthcare sector. Think big, start small, scale fast is a principle which is being adopted by NDHM. And on behalf of the organized sector in this country, I can assure our commitment and participation in this endeavor, which I believe will lead the country into the next era of healthcare. Thank you.
Thank you, Dr. K. Hari Prasad, and for very frankly sharing your views. And there's one interesting question is for you. I just got from audience that this NDHM is a open API based ecosystem. So how will it benefit private players? Why private players will go for it?
One of the biggest fallacies in this country is to distinguish between the private and the public healthcare providers. One needs to understand that ultimately the patient is the same, it's a human being, and care is being provided either in the public hospital or a private hospital. It's just the ownership is different and the way it is operated is different. But healthcare remains the same. So if it is benefiting the public sector, it will benefit the private sector, because ultimately it needs to benefit the patient. On top of that, there are certain specific things which I think will be very, very important. We have the CEO of NABH here. There needs to be a standardization of care across the country. There is no reason why someone should get a substandard care, then while another person who can afford or who can pay gets a better quality of care. There needs to be a platform which lets people know what is the quality of care, what is the, and this needs to be verifiable. The claims needs to be verifiable. And I think NDHM will throw out information which is for the benefit of good organizations, either in the private or in the public sector, who are providing great outcomes. And I think the benefit, we should look at it not in terms of the private or the public sector. We should look at it as a benefit for the community. And I believe that NDHM, by one of the greatest things it will do is it will make the whole system transparent. And by making it transparent, I think the people will benefit the most. And I think that is what we need to take home as the message.
Right, right. Great to know that, Dr. K. Prasad. And there are a lot of questions on cyber security and data security around NDHM. So, uh, Mr. Abhishek, I would like to ask you on this. Can you just give some more clarity to the audience? Because many questions I'm getting that because of robust use of technology, there will be a cybersecurity vulnerability or threat. So if you can throw some light on that.
Yeah, so coming to data security and privacy part, there are two aspects. How we are handling it at policy level and how we are handling it at implementation level. So coming to policy part, as I already said, citizen centricity is the key, and privacy and security are key principles on which NDHM is working. So at policy level, broadly, we have drafted three major policies. One is health data management policy. It is in draft stage and it was put up on NDHM portal for public comment and feedback. It was open for 1 month. So from public, we have received comment, and based upon those feedback, the policy is being further revised. Secondly, the first draft and the subsequent draft being prepared, they are being prepared on the basis of established laws, existing laws, as well as proposed personal data protection bill. So this is the key bill as far as understanding of policy from business perspective or end user perspective is concerned. So how data can be generated, how data can be collected, how data can be processed, each and every aspect is taken care of. And basic principle is without consent, no data can be collected and no data can be processed. Coming to data processing, the basic approach we are taking based upon established conventions and international standards is that if any data is to be processed, the person should clearly say what is the purpose for which data can be processed, including time limit as well. That this consent is for, let us say, 2 days or 3 days only. So we are taking into all these aspects so that individual is in control of data. Apart from that, we have designed two information security policies. One information security policy for our internal core system, other information security policy for external stakeholders who will operate in the ecosystem, because NDHM is a federated architecture. It is not a centralized database kind of system. So there will be many people who won't be working as such as part of NHA or NDHM, but they will be kind of operating in plug and play model with the NDHM. So even for them, information security policy is prescribed. So, and for each policy, we are going to ensure that each and every clause of the policy implemented at design stage itself, and we are creating clause wise compliance metrics so that each and every aspect is taken care of. So we are taking care of all concerns of privacy and security, both at policy level as well as implementation.
Right, right. Thank you, sir. And I think it might have more clarity to our audience. There's a question for you, Dr. K. Madan Gopal. This is like, what are your thoughts that to link Ayushman Bharat to NDHM, will it drive more people to digitize their records? There's a question from Mr. Varun for you, Dr. K. Madan Gopal.
Okay, that's fine. Very interesting because right now this digital mission is being piloted on a voluntary basis. If you look at the records, because the once the utility of the continuum is established, I think people will go forward and have their records. Slowly, it will build up. The awareness will be created, and I think in the coming days, more and more people will be going for the digitalized records. It's not that they will not go. The people right now, it is only being limited to people who want to seek treatment from outside the country. But in few of the countries, the main problem is even the practitioners who are there. Suppose I did a test today. Here, the role of the quality standards and other thing will come. If even if I'm having an electronic record, if I got a panel of tests done today, will the other hospital accept my records? The question is very difficult to answer. It's very difficult. One doctor doesn't recognize this because standardization is not there. Because how we can standardize that thing? That attempt is being made. We will try to bring out some standards, as Abhishek has rightly pointed out. We are working towards that. Once standards are built into place, NABH will have a role to play into that. If one hospital started accepting the records of another hospital, and that would be a day when everybody will recognize the importance of these records. Otherwise, till that time, it would be just we would be having these conferences. We have to put that thing to practice. Unless that thing is put into practice, how you are going to utilize this thing? That's a challenge, and this the industry and the other private player they have to answer this question because even if I get a NABL accredited lab records, if I go to some other institutions, they will not recognize the reports. Even if some records are created in Ayushman Bharat, if the private people they are not recognizing that records, then the whole purpose, whole of the things has to be redone. So we have to build awareness, we have to build a lot of capacities, we have to build standards. Slowly and slowly it will happen. But we have to bring that culture into the existing game of the things which are happening.
Right, right. Ms. Padma Jaiswal, you had to say something on this. You're on mute, madam.
I was listening to all the discussion very carefully, and so important inputs have arisen from the whole discussion which has taken place. But then I was also reading the few questions. See, we since UT of Puducherry has been given the task to implement this particular national digital health mission on the pilot basis. We are one of the 6 UTs which will be implemented it. So we have done some preliminary survey in this regard, and we are also very proximate to Bangalore, Hyderabad, and Chennai, where the major startups are in place. So what we have learned from the feedback that we have obtained from them after doing the online preliminary survey of our department was that they were treating it as a UPI moment. The UPI moment, which was been created, the platform which was been created by RBI for the fintechs, the same way it has been welcomed by the health startups also in Bangalore and in the Hyderabad. So they have been saying that whatever data which is coming to them, there are some that is more welcome for them to come out with more and more applications. So the private sector has really welcomed this move of national digital health mission, and also we have been discussing about cybersecurity things and also about this data protection. Now, since I know the data protection bill is underway in Parliament and has been pending for a long time, but still, private sector what they are saying is that the companies they're already following the European Commission GDPR rules. the general protection data protection rules. And every company, because every company is global, working globally these days, on various global countries. So there is no point of just following different kind of rules everywhere. So everybody is following those GDPR rules when it comes to data protection. So I would just like to tell you that also government has come out with a few very path breaking policies during this period of time, which will have an impact. It will have a positive feedback for positive impact on this national digital health mission. One is this, giving productivity link schemes, incentive schemes to aggregate our supply chain, distribution, which is taking place. And also the secondly is this about this Atmanirbharta. Now, this Atmanirbhar scheme and also the supply chain, aggregation scheme under which the government has come out with productivity link schemes, they will help a great, of to all the software companies and also these hardware companies, application companies to come out, with various kind of diagnostic tools and devices. Because telemedicine will be successful only when we have the digitized data and also to supplement and add on with the AI application software and also machine learning. Now, all these things will require a very state-of-art hardware and also software. And one more thing that government during this time period has also expedited the 5G trials. And government of Puducherry has also given permission to one of the companies who will be undertaking the 5G trials on the experimental and on the pilot basis in the UT of Puducherry on the selected areas. So these 5G trials, IoT devices, then this edge computing with supercomputing power, it is going to encourage this kind of data security data centers and also the cloud computing. This all will have a very good like favorable impact on this particular policy of the government of National Digital Health Mission. Well, I can only comment about the Puducherry UT of Puducherry where it has been taken very favorably this place is very favorable when it comes to social and economic indicators. But I cannot comment on what will happen in Ladakh or what will happen in the other places where maybe the 4G is not in place. And what I have also learned is that they will also come out with some kind of offline softwares to bring those people on board where the broadband availability is not there. So, as a whole, this scheme sounds to be quite promising in delivery of the healthcare services to the people, and this has been really a welcome step mode both in the private sector along with the startups. Also, the various engineering colleges in Puducherry has really, come out with various kind of ideas, hackathons, and pertaining to this kind of, health suggestions, health ideas. So there are various gaps in the system depending upon the local areas. So these gaps can be explored by collaboration with the startups, which are our huge youth population. So all these things have taken place, and I think it's a very promising, step in the right direction, which has
Right,
been
ma'am.
taken
I
by the
think
government.
Mr. Abhishek Kumar
Yes.
and Dr. K. Madan Gopal, they'll be very happy to see that states and UTs are participating so well with NDHM. So now I'll take it as your closing remarks, ma'am, and I'll move to other speakers for their closing remarks. I'll start with Dr. K. Madan Gopal. Sir, I request for your closing remark, but there is one more question for you. It is like, how will NDHM accelerate the country's progress towards universal health coverage, UHC? So, while answering this question, I request for your closing remarks, sir.
Okay, that's very. If you talk about the universal health coverage is one thing. Is there are two things which are moving in that direction. One is PMJ is step in that direction. The other thing is the enhancing the implementation of the health and wellness center, the upgrading the sub health centers and the few of the primary centers to the wellness health and wellness centers, and bringing the continuum of care from there to the PMJ. If all the circuits are been uh, plugged in and they are and the loop is closed and the loop starts working, then I think it will be moving in that direction. Both the streams are working closely, and we slowly and slowly we will see that how the integration happens. Definitely, it will accelerate the pace towards the universal healthcare. It will accelerate that. That's one thing. Apart from that, lastly, as a closing thing, I just want to submit only one thing. whatever technology solutions, we can't see that it would be a game changer in one day. It would be a game changer provided the practice is built into the technology and the technology and the practice go together. Because unless this aspect is taken care, rest of all the things are details. If you look at the implementation of the digital solutions in big hospitals, see where it has worked, why it has worked, and what benefit it has brought. We have seen a grappling example where a system was designed and the system was asked to adopt to that system which they have designed, which is not going to happen. A lot of
Right.
scope is there in the NDHM. After the pilot, we will see that how the things are evolving. It's not that it is a prescription which has been made. Pilots are done to see how the systems are evolved, the architecture is made, and how the issues which are there they can be plugged in so that the practice can be built into this technology and it can be a successful thing. That's the only thing which we are seeing that how the pilots will is very encouraging to hear that the small players are coming, but it's very difficult once it comes to practice. Everybody will talk about technology once it comes to use. It's very difficult to see that how the practice is made into actuality and reality. That's from my side. Thank you very much.
Thank you so much, sir. And I'll move on to Dr. K. Hari Prasad for your closing remarks. But there is one very interesting sort of question for you by one of the audience. He's asking that are there no concerns to private healthcare providers with NDHM?
Well, there are obviously when there is something coming up new, there are going to be concerns. There's an absolutely. It's not that the private healthcare sector is not worried about it. It is worried, but it is worried for genuine reasons, and it is worried for reasons because we at least we have gone through the entire digital journey so far, and we know how difficult it is at each step of implementation of the digital journey, and we know what are the difficulties which are already there in it, both on the technology front and on the human front. So we are worried about that. And when it is being done in such a humongous way across the country, a country as large as India, there are going to be many more challenges. So we are worried about the disruption that it could cause, and we are hoping that this would be a disruption which will help us move in the right direction. So that is the sentiment within the private health sector, at least within the organized health sector. There is a cause of concern, but we are looking at this being a game changer in the long run if implemented in the way it should be implemented, and if the players are all bought on board and they accept and use the system and find value with the system.
Thank you, Dr. K. Hari Prasad. And I will request now Dr. Atul Mohan Kocha for his closing remarks. And there is a question for you. I don't know how it is framed rightly or not. That how important is investment in hardware and software, and how will it be done? So there is a question from an audience, and if you would like to take that question, otherwise, please share your closing remarks.
See, hardware is NDHM is not only about hardware. It's not only about software. It's a way of life. It's an SOP which has been given to us. A step has been taken. A movement has been started. A revolution has been started rather. So going forward, as all of us have already said, this is something we have to build upon, and only time will tell us how successful we are. But over time, we see that over the past decade and a half, we have managed to create islands of excellence. We call our hospitals, all NABH accredited hospitals, in whatever program, they are small islands of excellence which we managed to create. But if we are to talk about the universal health coverage, which Dr. Madhur Gopal said, or we are to move on towards SDG 30 Sustainable Development Goals, then we have to create a ecosystem of quality, what Abhishek ji said. And the only way today to take that movement, to create that culture of quality to in everything, is by a digitalization. And that digitization can only happen through this movement of NDHM. So this is a wonderful opportunity given to us to reach out to people, to the last man in the lines, and tell them about patient safety goals, the basics of hand hygiene, the basics of good communications, the basic of surgical safety checklist. I mean, we are a very diverse and big and geographically and economically different country, wide country. So we have to, and this is the modality which will integrate us, which will connect us, and which will take us to the future. So thank you so much.
Thank you.
Karthik,
Thank
I'm
you,
sorry.
Dr.
Karthik, I'm sorry. I'll have to move on to another call. So thank you. It was
Okay.
wonderful, and I would request other panelists to excuse me for running away. Thank you so much.
Thank you, sir. However, we are just closing in a couple of minutes, but thank you so much. Uh, so my last, because the only Abhishek Kumarji is left, and Abhishek Kumarji, I would request for your closing remarks. And before that, there are a lot of questions on interoperability, and some of them are targeted to you also. That interoperability, how can it be ensured at the national level, and how, as a country, we are placed? India is placed. So, if you just throw some light on that in your closing remarks, please.
Yeah, so interoperability, it is the most critical aspect of NDHM, I will say, because when we say national digital health ecosystem is to be established, it means that we are moving from silos to an integrated ecosystem. So how an interoperable system can be established? There are two aspects to it. First is prescribing standards, technology standards, and data standards. So that work we are already doing, so that across India people know which standards are to be adopted. So that is the easier step. Difficult step is making sure that people adopt it. And as it has been emphasized by many speakers, NDHM is a journey. Everything can't be achieved in a day. We have made a beginning, and as people will start seeing the value proposition, how it is leading to benefits, most importantly to citizens, and then to various providers, doctors, hospital, everybody. So people will start moving towards it. So as I see it, in the beginning, the progress may be incremental, but after some time, a reasonable number of hospitals, labs, people, everybody adopts this system, the value proposition will become very apparent, and there will be natural push for remaining parties to join the system. That is how interoperability will be ensured. Coming to next point, I would like to clarify just one point based on discussion so far. When we say NDHM is to be adopted in PMJ, Pradhan Mantri Jan Arogya Yojana, or any hospital, it has broadly two steps. First step is adoption of our identifier, means health ID, DigiDoctor ID, hospital ID. That is the first step, and that is relatively easier step. Second step is about adoption of standards, health standards, designing EHR based upon those standards and implementing it in various hospitals and labs. That is relatively difficult steps because it amounts to changing the habits of doctors, hospitals, and their staff. So, as far as first step is concerned, it can be done easily, and that will give sufficient value proposition to citizens as well as facility. And to conclude, the last point, any project of this scale can succeed only if we are able to build a trust with everybody, with all the stakeholders in the system. So we are working hard and sincerely to build this trust element, and we hope that we will succeed. Thank you.
Thank you. Thank you. Thank you, sir. And here we close the session. Thank you, everybody, especially our panelists, for joining us, and the audience for being there. And we would like to give you the participation certificates as a small token of thanks and appreciation to all of you panelists for joining us, sparing your time for us. So I request my colleague Deepak in backend to present the speaker certificates, a virtual form of speaker memento to Ma'am Padma Jaiswal, Secretary in Government of Puducherry. Thank you so much, Padma ji, for joining us. And next, Dr. K. Madan Gopal, Senior Consultant in Niti Aayog. Thank you so much, sir. And my apologies, sir. Dr. Isman mentioned the certificate. I apologize for it. We'll correct it. And then Dr. Atul Mohan Kocha, CEO of NABH, for joining us. Thank you so much, Dr. Atul. And then Mr. Abhishek Kumar, Executive Director of IT in Ayushman Bharat, PMJAY. Thank you so much, Mr. Abhishek Kumar. And then Dr. K. Hari Prasad, he spoke wonderfully, and we thank him also for joining us. So here we wrap up this session. Thank you, and see you again in some other interesting session in future. And we request you to please keep joining us for such interesting interactions, because audience love to listen to you on these important topics. Thank you so much. Thank you so much.
Thank you.
Thank